Today, we're diving into a serious growing health concern, strokes in young people. It's no longer just a condition affecting older adults. More and more young Bahamians are experiencing stroke, and hypertension is often at the root of it. Joining us today is Dr. Levard Roberts, a nephrologist in hypertension and stroke prevention, to help us understand why this is happening and what we can do about it. Welcome to What's Trending, Dr. Roberts.
Thank you for having me.
Well, it's great to have you here with us. So let's start with what you're seeing in your practice. How significant is the rise in strokes among younger Bahamians?
So it's almost difficult to talk about strokes without talking about hypertension. I think we're seeing a significant increased amount of strokes, although we're doing much better at stroke treatment and management. The death by strokes have improved, but we're seeing a significant amount more strokes, not only because of more hypertensive or uncontrolled hypertension, but also we're living longer lives as well. For example, for our population, I think about 45% of our population are actually hypertensive, and only about 50 to 60% of those are actually diagnosed. And of that 50 to 60%, only about 70% of them are actually on treatment, and half of them being on their target goal for treatment. So hypertension is a big, significant component.
So what are some of the risk factors that you're noticing in younger person as it relates to stroke and that connection with hypertension?
So just being Bahamian, we actually have a genetic increased risk factors for being hypertensive. And hypertension is over a 200% increased risk factor for stroke. And that's the ones that cause the blood clots and the ones that cause the bleeds. So we're seeing a significant increase in the amount of hypertensive. So we have a genetic component, and our lifestyle does not help. So risk factors just being sedentary, not being active, low exercise levels, poor diet, all these things actually increase our risk factors for poorly controlled hypertension, by extension, strokes.
And do you think most persons know that they are, or even have a risk for high blood pressure? Because, most people say, well, I'm young, I'm healthy, I don't need to be thinking about no blood pressure.
I can tell you the most famous thing I hear, I ain't gonna claim it. That's the most things our Bahamians say.
Very Bahamian too.
So if we don't claim it, that means we don't have it. But unfortunately, hypertension is the silent killer. We tend not to get symptoms until the end organ damage, as we would say in medicine. That's when the hypertension has reached levels that is actually destroying the organs within our body. For example, the strokes, that's it, destroying the brain in a way.
And how can persons deal with this? What are some of the how early should young people start to check for these things? Like you say, we see it at the end result when the strokes emerge. But how soon should persons be checking in for their risk factors, concerns to prevent that?
So believe it or not, anybody over 18, once you are seeing a medical physician for any reason, you should be screened for high blood pressure. That's checking to make sure your top number is below 140 and that bottom number is below 90. Because of our increased risk factors, especially if you have a strong family history, if you know you're living a life that's not healthy, you should actually be checking your blood pressures at home to make sure you don't fit that category.
And do you think that there is a lack of awareness on the urgency of having this done, especially for people under 40? I know you mentioned once over 18, but under 40 is, that's a key age too.
Yeah, definitely. I know most of my colleagues would agree, like in the last 15 to 20 years, you're seeing 60-year-olds turning into the 30-year-olds. You've been seeing a lot of strokes in 30 and 40-year-olds, hypertension that's really out of control. Because we don't feel the symptoms and we wait until the last minute, you got young persons that are presenting with strokes, significant kidney disease, and heart disease, all because we feel like nothing is going on and we're immune to it all.
And what then are some of the early warning signs for persons that have hypertension, or even for someone that has maybe an impending stroke?
So hypertension, it'd be more so when you start to feel like headaches, blurred vision, neck pain. Okay, those are some of the symptoms that you'd have at very high blood pressures. Also, for strokes, we talk about the acronym FAST. Okay, that's when basically you have a facial asymmetry, their speech is actually impaired. Okay, and time is the most efficient thing. So if you notice these things in one of your friends, colleagues, you want to get them to a physician as soon as possible, because some of these strokes are reversible. And the longer we wait for treatment, the more irreversible damage that happens.
And then, the lifestyle changes are key. So what are some of the simple lifestyle changes that persons can make to probably eliminate, even though you say we're Bahamian and it's a part of who we are, you know? But what are some of the lifestyle changes that we can put in practice?
Number one, I'd say is diet, diet, diet. Compared to our Caribbean counterparts, we consume the highest amount of salt there is. You know, our average salt intake is over 7 grams a day. Persons who are hypertensive, we aim for 2, okay? But the more salt we intake, that's anytime you ingest food that is bought out and not prepared, this is actually high in salt. And there are things that are naturally high in salt. Anytime you open canned foods, those things are high in salt. And you know, the way we could season food without using additives like salt, you know, you can use fresh pepper, herbs, garlic, lime, lemon. It still provides flavor to the food without adding that sodium component that increases our risk factors.
So then tell us, how much does chronic stress, that's from financial pressures, the media or social media, contribute to hypertension or stroke risk in young adults?
So there is a significant studied component that has been shown. So if we separate into the two, there's the psychosocial, that's being stressed at home, stress around the place, when you just feel stress in your own social life. That actually increases your risk of stroke and hypertension by almost 30 to 40%. And then there's the chronic stressful state, that's the job-related stress, okay? Because if you think about it, when we get stressed, our natural response is basically flight or fight, right?
Pretty much.
And that's when you have surge of adrenaline, surge of cortisol. So if you stay in that stressful environment, you have these hormones that actually raise your blood pressure chronically, and that can increase your risk of stroke and hypertension by 1.5 to 2 times the amount.
So now, if someone does have high blood pressure, they've done what they do, they know that they have high blood pressure, how can it be managed, and is it something that can be reversed?
Yeah, so when we look at hypertension, we're talking more so about primary hypertension. There's a subgroup called secondary where you're born with something that increases your risk of high blood pressure, and you can't do anything but treat that specifically. But when we talk about lowering our risk factors and managing our hypertension, we talk about our non-pharmacological or non-medication based. That's basically with our diet. We talk about the DASH diet, the diet approach stopping hypertension. That's your high fruits and vegetables, staying away from your low flats and saturated fruits. So diet can lower your blood pressure by 10 or more, okay? Then we talk about exercise. You want to exercise at least for 30 minutes, 5 days a week. Exercise promotes that, taken away from that couch potato attitude. And then seeing your physician, recognizing early steps, getting screened, knowing when lifestyle is not enough, and then medications are necessary. Some people don't like medications. They don't want to be on the pills. They don't like the side effects.
Not all. They don't want to deal with it.
There are many ways we can treat hypertension, keep it controlled, lower your risk factors altogether.
Wonderful. So once someone has had a stroke, even a mild one, what does recovery look like for that person, especially for younger patients?
So my biggest concern, sometimes we get strokes and we have no symptoms, so it comes right back down to normal. We call it like a transient or passing stroke. One of those, they actually increase your risk for another stroke. And if left unchecked, if the cholesterol is not controlled, if your risk factors for stroke are not controlled, then your risk for a larger and more debilitating stroke comes in. That's when we talk about secondary prevention. So just because you were lucky to have just a passing of a stroke doesn't mean another impending one, especially in the next 3 months, is at a very, very high risk.
Wow. Well, thank you so much, Dr. Roberts, for joining us today and talking to us about this alarming trend that all of us can, take in hand and be mindful of what we need to do for better and healthier lifestyles.
No problem. Thanks again.
Well, if you're young and you think that you're too healthy to worry about high blood pressure, think again, because prevention is key. Now, as families gear up for back-to-school season, Dr. Carlos Thomas, a board-certified pediatrician, will share practical tips to keep kids healthy, rested, and ready for a successful year. You don't want to miss that. This important conversation, that and more, right after the break. Stay with us.